Welcome back. You're watching India Tonight. Is the sweet tooth leading to a bitter pill for Indians? A latest study, which was published in the Lancet, has revealed that over 100 million, or roughly 11% of Indians, are either diabetic or pre-diabetic. That means they have some kind of metabolic disorder. The survey found that 136 million people, or 15.3% of the people, could be living with pre-diabetes. The highest prevalence of diabetes was observed in the states of Goa, Puducherry and Kerala. To talk more on this, I'm joined now by Dr. Shashank Joshi. He is president of the Indian Academy of Diabetes and consultant at Lilavati Hospital, and he is also one of the authors of this study, which is truly a comprehensive one. Dr. Joshi, thank you so much for speaking with us on this. Tell us, how bad is the situation? The statistics are definitely scary.
So thank you so much, Tamanna, for having me here. And first, let me congratulate the Indian Council of Medical Research and Professor V. Mohan's team for this unique study. This is the largest nationwide study on planet Earth, which has mapped every state of India and beyond every state of India to union territories as well. And we are seeing that we have a large, almost 100 plus million people living with diabetes and an equally larger number with pre-diabetes. And it is the pre-diabetes numbers which scare us because that is the walking and ticking time bomb. So, India is a heterogeneous country and different geographies have different numbers. Many parts of India, as you have rightly pointed out, are 1 in 4 prevalence with people living with diabetes. And there are states like Uttar Pradesh where the largest state of India has only 4% prevalence or 5% prevalence with people living with diabetes, but they have a high prevalence of pre-diabetes of almost 18%, which means that they have a call for action. They need to look out that they can be the next population which needs to really follow. Now, you know that India is a very unique country because we are centrally governed with health policies coming from the center, but the execution of those policies are state generated. And this unique study is also combining urban India and rural India. And it started way back in 2008. So it is a very systematic study across running the length and span of the country, and really congratulate both the Government of India agency, Indian Council of Medical Research, and Dr. V. Mohan, who's one of the foremost diabetologists on planet Earth, for conducting this study with a unique group of domain experts from each state of India. So you have the best public health specialists, clinical specialists, as well as the Indian Council of Medical
Joshi,
Research.
for our viewers who are seeing this, they're seeing these scary figures, and everyone anecdotally knows that the prevalence of diabetes has gone up massively. The ages at which its onset is also earlier and earlier. So what is the reason? I know the common knowledge is that people are eating more junk food, walking around less. Is it as simple as that?
Tamanna, the game changer has been probably the COVID pandemic. And there are 3 reasons for that. Number one is that the awareness went up in COVID because hypertension and diabetes were 2 important comorbidities, and therefore people tested much more. That's number one. Number two, definitely COVID had some linkage and contribution in development of diabetes or unmasking latent diabetes. People ate too much, people were more sedentary, and there was a lot of mental stress. And all these factors probably played a role. And beyond all these 2 things, the awareness has gone up both in rural and urban India. So all these 3 reasons, as we improve our socioeconomic status and improve our demographic dividend, one of the prices we pay is non-communicable diseases. So it is a sedentary lifestyle, the digitalization, which we can see, as well as excess caloric intake and a lot of mental stress, which has contributed to these numbers. And it's also a lot of awareness which is going on. And that is probably causing this jump from 70 million to 100 million, which has been seen in the last 4 to 5 years.
Another interesting aspect of this study is that the urban-rural divide in terms of prevalence of diabetes is not as much as one would expect. That diabetes or pre-diabetes is in quite a significant manner present in rural India as well, more than what was previously estimated. Can you speak to that? Because some of these factors you've mentioned are widely expected to be less in rural India, less digitalization, less sedentary lifestyles, etc.
So, Dr. Anjana, who's the first author of this study, made this very important comment yesterday that the rural India is the real tip of the iceberg. And 2/3 of people in rural India did not know that they are living with diabetes. And this was a finding which we found way back in 2011 when the first part of the study was published. And clearly we recognize that rural India is also sedentary, it is also digitalized, it is also eating the wrong food habits, and it's also under a lot of mental stress. And probably in times to come, in a decade to come, rural India will have probably more diabetes than urban India. And this is a worrisome figure. And I congratulate both the governmental and non-governmental agencies for calling for action for diabetes prevention. And now we have diabetes on the national agenda as a part of our national program.
What should be the policy intervention? You said that this is a call to action. For some states, I think broadly on a central level also it's a call to action. So what should government do?
So I think we need to really look at improving the physical health and activity of people, building some muscle mass. We need to cut down our calorie content. So it's health education in a big way, capacity building, ensuring that access and affordable medications are available to most people. And awareness is the key. Screening awareness is the key. For example, if somebody is having family history of diabetes, and has a waist circumference for a man more than 90 centimeters or for a woman more than 80 centimeters, then even after the age 20, we should screen for diabetes, test for diabetes. So I think it's awareness, education, empowerment, and ensuring that affordable, accessible care is there to the last mile, to the best of best and the worst of worst. And I think India is uniquely placed because probably we have the most affordable and accessible healthcare deliverables in diabetes statistics. And therefore, our goal is to ensure that we try to keep it complication free because the real burden of the disease is not in diabetes per se, but it's in the complications which it incurs, whether it is heart disease or kidney disease and others. And that's really the call for action. And that is why it's important that, ICMR has taken this unique initiative for recognizing that we have a problem and addressing it from the root cause by some strong public health interventions, including health education and inculcating the right lifestyle habits.
Okay, on popular demand, this question has come in, and I know you're a specialist in this field, but people want to know that what do we eat then? Is it as simple as don't have too much sugar and you'll be fine? And there's seriously a lack of knowledge on what would seem very commonplace.
So I think it's a very simple thing. There are a lot of food myths around. And Tamanna, you're very right. So the first simple thing is eat less, portion control, share and taste, but don't eat too much. Eat on time, eat slowly, eat too fast, and eat right. Avoid sweets, fried food, fast food, and dry fruits except almonds and walnuts. Try to do physical activity. So do some yoga, do some Surya Namaskar, do some Uthak Baitak. Try to do 10,000 steps a day. Try to sleep well, sleep for 7 hours, do a digital detox for an hour, and always be happy. It's important to recognize that it's not just eating. Eating has to be as a part of a lifestyle, prescription. And it's very, very important to recognize that.
Simple formula is the one that works, but I think also important to be focused and to be aware. Do your tests. Don't just assume that, you're fit and this won't happen to you. Thank you so much, Dr. Joshi. Pleasure as always to speak with you.
Thank you.